My name is Caldwell Lewin, and I am the Director of Perioperative Services, Infection Prevention, and Employee Health Nurse here at St. Bernard Parish Hospital. I'm a registered nurse. I'm board certified in infection control, and I'm also certified in healthcare quality.
Well, first of all, how do you pronounce your name? What's the best way to pronounce your name?
So my first name is Caldwell.
Caldwell.
Yep, and last name is Lewin. So Lewinsky without the ski.
Okay, right on. Well, Ms. Caldwell, tell me about yourself. What's your background? How did you get into medicine and then later into infection control?
So my background actually is I have an undergrad in psychology and wasn't really sure what to do with that, and knew I liked the medical field, and for the first time in my life took the advice of my mother and decided to go to nursing school, which has served me extremely well. So I've been a nurse for 22 years, primarily in critical care and emergency medicine. And about, I guess it's been 5 years ago now, I had the opportunity to take a role as an infection preventionist in a hospital in Sitka, Alaska. Wasn't 100% sure what that job was going to look like or what it was. But I went into it, and there was no one to give me any information prior to, because they didn't have anyone in that role. So I ended up doing tons of self-education and ended up finding infection prevention touches every aspect of healthcare. And I absolutely loved it, which kind of led me on the journey to become board certified in infection control, which then trickled into this is absolutely what I was made to do. And I'm now in a master's program for my master's in nursing with a focus on infection control. So that's kind of how I got to infection control.
Yeah.
So what happened? So we were up in Alaska. My husband and I were up in Alaska for the past, I guess it was 5 years. And he got transferred down to Louisiana. And I was planning on taking a pause, enjoying everything that Louisiana had to offer, and driving across the country. I'm very proactive and very type A, and I like to get stuff done and have a plan and an agenda.
Yeah.
And so there was a job opening at St. Bernard for an infection preventionist. So I quickly had I'm calling my mom, I think we were in Montana, asking her to update my resume so I could quick send it out. I mean, it was trying to do it on a little phone, in and out of cell service, but we did that, and kind of trickled into finding this great little gem of a hospital, and I hit the ground running.
So how do you like the community? How has your integration into the community been?
It's been great. I will say I grew up in Atlanta, and we had not been anywhere near the South in the past 12 years. So coming from Alaska, I was happy to be coming back what I equate to home. Anywhere southern and warm is happy for me. But also I was on an island in Southeast Alaska, a town of 8,000 people. So the first time I'd been in a small community, and coming to Chalmette, it very much feels that way in a lot of ways. I mean, you have so much more access to larger things, but I do feel like it's a really tight-knit community here, which is lovely.
That's great. So let's switch gears a little bit. What does an infection preventionist do?
It's a mouthful.
What's the day in life look like?
So a little bit of everything. So primarily my job is to make sure that our patients coming into our healthcare facility remain safe, but also that our staff is safe. And a large part of what I do is I provide education. I'm a resource for all the staff. I'm a resource for families. I'm also constantly monitoring best practice for all the different types of procedures that would occur in a healthcare facility, and ensuring that we're meeting and performing those things in a really safe fashion and preventing the spread of infection. So on any given day, I come into work, and I usually round in all the areas of the hospital, touch base with people. I review all our patients that are in the hospital, making sure that there's nothing that we need to be aware of. And part of the key to infection prevention is knowing what infectious agent is occurring and isolating that. And so really making sure that we're doing, like, as a staff, following those best practices to keep ourselves safe again and to keep our patients safe.
I know the St. Bernard Parish Hospital is part of the Ochsner umbrella. Does that help? Does that give you extra resources to do your job better?
Absolutely. And that was one of the appeals to me when I found the job opportunity. Again, when I started my kind of journey into infection control, I was in a small island in Southeast Alaska, and it was me. And so there's always that constant, if you're your only resource, it's nice to have coming here a huge community of medical professionals with a vast array of backgrounds and support, and really being able to collaborate together to make sure that we're kind of at the cutting edge of what best practice is and providing that level of care to the patients that we serve. So it's really a great way to, I guess, provide medicine and provide care.
Certainly. So where do you find, like, satisfaction in your job, and where do you find your biggest challenges?
So my love for it is seeing the end results. It's seeing our patients staying safe, where our infection rate is extremely low at this hospital. And I credit that to the diligence of the staff. I've been told, I'm very vocal and I like to make sure that everyone's doing what they need to be doing and really thinking about the chain of infection. My biggest joy is, because I'm having to touch all aspects of the facility and working with staff and patients and family members, is really finding that, what's going to connect for them to understand what information I'm providing, and seeing that transpire. I really feel like that's so rewarding. I think the challenge is, like I said, there's one of me, and, I certainly can't be everywhere at once. And we do monthly orientations, and I always charge all of our new hires, there's one of me, but all of us, every person truly is an infection preventionist. You all want to work to do the right things to prevent infections for yourself and for others.
Right.
So I think the challenge is, again, just being one person.
Right. So I think at this point in the year, everybody's been kind of inundated with corona virus information and misinformation and conspiracy and whatnot. What are some specifics into what we know about dealing with the SARS-CoV-2 coronavirus pandemic?
So I think, this is a novel bug in a lot of ways. This is an experience I've read about it in books. I've studied about it. In some ways people are like, this is an infection preventionist dream, in the sense that I really get to utilize all my skills.
Yeah.
But when it really boils down to it, it goes back to the basics of infection prevention, which is knowing what the chain of infection is, and knowing that we have to break it, and you break it by practicing good hand hygiene, by not coughing and sneezing on people. And I think when you really look at that, you can, peel back all the information, all the scientific data, and really break it down to very simple things that any of us can do that will make all the difference and keep our loved ones safe.
No, that totally makes sense. What is the difference between, like, the SARS-CoV-2 and COVID-19?
So I'm not sure I'm going to be able to 100% answer that correctly. So COVID-19 is, there's all kinds of coronaviruses that live in the world that we are all exposed to every day, in a sense, like those are colds, respiratory. So all these viruses get into our bodies and can cause different symptoms or cause no symptoms. This specific virus that's turned into a pandemic, and part of that is because of how highly contagious it is. And what that means is that where like maybe a common cold, you might have the potential to infect one other person when you're symptomatic. This one, and again, all the data is changing constantly, but they're saying instead of just one person, you're likely to affect, three people potentially, which really changes how rapidly a disease is spread within a community, within, the US and within the world. Mm-hmm. I mean, you look at how quickly all of that happened.
What are some common ways the virus is spread?
So what they are really saying, I think and that's probably the most important thing people need to know. So currently it really is thought to be spread from person to person. And specifically, it's when you're within close contact of someone, so less than 6 feet. And what happens is when a person's talking, if they're coughing or any of that, there's little tiny droplets that come out of their mouth that you don't see. And the potential then, if you're standing really close proximity to them, that these droplets have a tendency to go in your mouth or go in your nose, which then get inhaled and into your lungs and respiratory tract, which can cause the infection. And it's not necessarily cause the infection as much as it causes the exposure. That's what happens. So that's where knowing that is the primary way it's spread. I mean, there's some question, and again, they don't really know 100%. They're thinking it's not spread as much from, touching a surface and then, touching your face or mouth. However, if someone just sneezes on that surface and you touch it and then touch your mouth or your nose, the possibility is there.
Yeah.
So I think that's a really important takeaway. It is close proximity, speaking, talking with all those droplets coming out of your mouth.
So then what are some easy everyday preventative steps? So
especially with any pandemic, the best way to prevent becoming infected is to avoid being exposed. So obviously the best way to not be exposed is to not be interacting with a lot of individuals. However, that's not a long-term reality. So then we have to look at what are the other measures that we can take to really keep ourselves safe. The number one best thing anyone can do is wash their hands. So wash your hands 20 seconds, soap and water, or if that's not available, hand sanitize. And hand sanitize for 15 seconds, making sure you're really getting all the surfaces of your hands. The next thing we can do is really respect that social. I know we're all hearing social distance, but it is that 6 feet space. And part of that is to really, what the thought is the droplets that are coming out, they're not suspended in the air. They have about a 6 feet range depending on how forcefully they're coming out of someone else's mouth. So that 6 feet is another measure to help keep you safe. And then the final one is using, there's a couple others. If you are coughing or sneezing, is obviously not just coughing or sneezing. Coughing into your elbow or using a tissue. And what we're all hearing now is all the mask use. And so really the request is by putting on a mask, what that does is that keeps all of your droplets to you. And so that's a measure to help protect other people. But in the same measure, we're asking other people to wear them as well to protect you. And
so, when we're talking about masks, why do we wear them? You said to protect other people, but how does that work? What is the mechanism in that?
So, and probably one of my biggest challenges as an infection preventionist in a hospital is making sure that I have buy-in when I'm teaching the staff here what measures, as a healthcare worker we need to do to protect ourselves and protect our patients. We've now provided that information to the public, and we're asking them to understand the same processes. And the biggest concern, what they're finding with this specific virus, is that not everyone that's exposed and actually develops the virus is symptomatic. Mm-hmm. So the reality is, I could be exposed, have no awareness of that, going around, no mask on, maybe not washing my hands great, and I'm running the risk of exposing so many other people. And I know oftentimes a lot of people are like, oh, that's fine, I'll get it. But for our vulnerable population, our patients that have a compromised immune system, those are the people that are really at risk. And so I think then asking everyone to be really respectful, put the mask on, social distance, we're really controlling the source of that infectious agent across the board, which really decreases the risk of exposure in the community.
All right. So I know there's different kinds of like coverings. I've got a few here. I've got the cheap little ones that we were giving out.
Yeah.
And then I do have an N95 mask that I've had for a while that I've been using for like spray painting, and I've redone it in a way so that I can fit over my ears, which I know isn't the ideal. It's improper use. But when we're talking about just, your normal face mask, what is the proper way to put it on and take it off and, deal with it?
So you're gonna touch on another one of my, like, if I could teach everyone anywhere, like people are gonna start seeing me like knocking on their windows and stuff. So face mask. This is, yes. I'm gonna to put it on. You've got your loops around your ears. You're gonna put it on an ear and then put it on the other ear. You want to make sure that it covers over your nose, it's going under your chin, and there's not a lot of gaps here, right? So then this whole area is really staying contained.
Yeah.
Now then you see people doing this.
Right.
This doesn't help because stuff coming out.
Yeah.
Or I see people doing this. They kind of, I don't know what they do. Like there's, or have your drink. Or rule of thumb is once you put this mask on, you don't want to touch it.
Yeah.
You're putting it on, you're keeping all of your germs in here, you're protecting, and there is some level of protection from, obviously, if you're covering up your nose and your mouth from inhaling droplets from someone else.
Yeah.
The other thing is, like, I know people put it on and they like to do this.
Yeah.
So I'm breathing all this stuff on here. This whole area of the mask is dirty. Like once we put it on, it's considered dirty. The safest thing to do, and now this isn't going to stay on, is when we take it off this way, like that, and then it goes into the wash.
Okay.
Wash it. We should be washing it every day. You don't want to put it on and then not remember what side you had it on. Because once we use it, it's dirty.
Yeah.
And we need to keep that in mind.
Yeah. Well, that makes sense. So taking...
You were kind of asking about like the different types of masks. So the N95, and I know people have access to different masks. The reality is for the general public, when you're going out to the grocery store or you're going, I don't know, you're going to McDonald's. I can't go into McDonald's, but if you're going out into public, you don't need to go purchase these expensive masks. I mean, truly, and there have been, I think on the CDC website, it shows you how to take a bandana and put it, like to tie it on appropriately. Just really contain what's coming out of your mouth, but also it does provide a layer of protection for you. I've even seen masks. I think someone was cutting up leggings and making masks out of leggings. I mean, people are getting pretty creative. The N95 masks are specifically, so we actually perform a thing called fit testing with our employees, which means that they go through a whole series of things that we test. And those masks that we use in the healthcare are specifically designed for really fine particles that actually are suspended in the air. Mm-hmm. And you see that with tuberculosis. So if we had a patient with tuberculosis, that would be a situation where we use that. If we're like healthcare workers, obviously you are at a significantly higher risk of being exposed to airborne pathogens or airborne infectious agents. And so that's why we utilize those in the healthcare setting. There is absolutely no reason that the general population needs to go to that extreme.
Walking around with one of these on.
And people do, and like, you know what? If you're wearing a mask and you're wearing it right, awesome, because that's what we need to do, because ultimately the only way that we're going to control this pandemic is to isolate it and to identify. So that's really, and I think part of what we saw when this first took off is we didn't have the ability to quickly test people. And normally what happens when you have an outbreak of some sort is the health department quickly, between your hospital infection preventionists, doctors, and the health department work together. They find out, they get really quickly down to what the source was, like where did it start? And they end up doing contact tracing and reaching out to all the people that person came into contact with. Yeah. And what that does is quickly confirm, they can quickly confirm a diagnosis and have those people self-isolate for the time so that they're not then going out to spread it to other people. And unfortunately, we kind of caught this after it had already had it already spread so far. So that was why we started with the, stay-at-home orders, truthfully. Right. That was the fastest way to really try to isolate this organism and to try to really slow the spread of what was going on.
Yeah. Have like the PPE, the personal protective equipment, like the N95 mask, production increased to a level where I know I was hearing that like nurses and hospital staff didn't have access to them. Has that changed at all?
And like we were really fortunate, and I guess it's where I feel really proud to work for Ochsner Health system. They really stayed on top of it. They worked, just so many people working tirelessly to make sure that we were all protected. Now we had to make some tweaks to how we were doing that, and we had to conserve our PPE a little more and be much more purposeful in what we were doing, but at the same level still being able to protect all our healthcare workers, which is great. I think because there has been a drop in patients in the hospital with COVID, then we're not using as many PPE. And so our supplies are at a great level right now. But again, no one, and it was interesting, I was reading in one of my books the other day about pandemics, and pretty much word for word was predicting, if this happened, just the PPE shortage and what was going to happen, because you can't even, I think you can read it conceptually, but not really realize that when everyone in the world needs PPE, like we're not going to have them. That becomes an issue.
So earlier you mentioned also social distancing. What can you tell us about social distancing? How does that work in public? How does that work in like a restaurant? How does that work, for example, in the hospital?
So hospital, it's where I'm going to have to toot Ochsner's horn again about how they've really thought this through to come up with options for patients. So we've got virtual visits now. We've really changed the platform to provide care. However, we've also taken a ton of measures to ensure that when patients and family members do come into the hospital, that we're keeping them safe. We want them to feel safe, mm-hmm. and know that we can still provide exceptional care here. Social distancing, that's that second level. Like if we have to go out, and you're standing in line at the grocery store and those stickers are on the floor, respect those stickers. You don't need to stand right next to the person in front of you. I think it's like we all have let's just pretend like we all have a big box around us and stand back. And that again is another measure to space you out, so that if the person in front of you did not have a mask on and they're talking, that you're far enough back from them that you're not running into a risk of having those droplets that potentially have an infectious agent in them, mm-hmm. getting into your body.
Yeah.
So I think, and that's the thing with restaurants. Yeah. I think it's really, we need to, I understand people need to interact with people.
Yeah.
I mean, there's something about, I mean, we need, human contact. We need that personal interaction, but in the same breath, we need to really understand that, an organism is going to enter your mouth. I mean, into your mouth. It's going to enter your body through your mouth, your nose, your eyes. If you have an open cut or wound, those are the places that it's going to get into your body and potentially cause an infection. So, if you are at a restaurant, try not to, it's like, I pretend like there's a big square around my head. Mm-hmm. And anytime you go out, it's don't touch anything above my shoulders the whole time I'm out until I can wash my hands. Right. And then if you really have to, scratch your eye, try not to do it. It's like I tell my kids, touch your face. I mean, that goes a long way.
Yeah, 100%. So I guess the logical next step would be, how do you feel about Louisiana's moved into this phase 1 this weekend, this coming week?
I think we have to get back to that. I mean, we have to get back to life, but I hope there's that awareness. It was tough. It was, I mean, from my perspective, I mean, it was tough here. There were a lot of really sick people. And so I think it's great the way, I mean, the CDC kind of lined it out. Louisiana has kind of lined it out, and it's that phased approach. So this phase 1 isn't, let's all go out and go back to our, big concerts in the park. Yeah. It's still, if you don't need to go out, then don't, you don't. And again, I know people, we don't, everyone doesn't know who's infected or not, for lack of a better, like, you may not know, you may not have symptoms. And so I think it's just being very purposeful still with what we're doing. It doesn't say we don't need to wash our hands anymore. We don't need to practice social distancing. I think this is just the next step to having people go back and, staying safe while they're doing it.
I know, since businesses are reopening, and, they have to keep their staff and customers and clients and the community safe. I know Ochsner Health has a new initiative in place, something called Safe to Return, the Safe to Return program. Can you tell us a bit about that?
I can tell you a little bit. I actually looked on the website and I printed it up. So for anyone, they can go to Ochsner's website and there is a toolkit, which I don't know, it's the Safe to Return employer toolkit. Yeah. There is such great information in here. So I would encourage any business just they can go on that website and get that information. There are levels. They have like a level 1, a level 2, and a level 3 with different services that they can offer. I think there's like level 1 goes into, there's some virtual clinic options. There's some options for having someone come and do temperature checks and that sort of thing. But really it's, from a business standpoint, it's reasonable to have people wear masks when they're, there. Why not put hand sanitizer by the door so people can use that when they're coming into your business? I mean, there's some really simple things we can do to keep customers safe and the employees safe.
Well, thank you, Caldwell. This has been wonderful. Lastly, is there anything you'd like to say to the St. Bernard and greater New Orleans community?
Oh, no, I mean, what a great community. And I think, if you don't remember anything else, just wash your hands, wash them frequently, more than you need to, and wear your mask.
Yeah.
So,
well, great.
Thank you for your time.
Thank you very much. Perfect. 100%.
All right.
That's it. How'd that feel?
It was good. I get a little bit nervous public speaking, but I'm like, I can talk to one person. I could talk forever.
Yeah. Well, great. No, it was great. I think you've given me tons of great, footage to work with, and now I can go do my thing with it and make it into something that is informative, but also helps, Ochsner and helps the Parish Hospital do
Honestly, I hope it helps. I would love, it's that, again, it's like what you said, there's so many conspiracy theories, there's so much stuff on Facebook, and where are people getting the information? And that's the one piece. The CDC has a lot of just general public health information about coronavirus and simple things you can do. From cleaning and disinfecting your house to, what measures you should take if you have a loved one that's home and potentially immunocompromised or frail, to keep them safe. So I think great resources there. And truly, I look at, I'm here to provide information to the community as well as to the people in the hospital. So